All right, hello everyone. So we've got a few days left for your P4 exam, and I've received a lot of requests for a plan a study question video and to making a video on how to design or plan your own study. So I've given you here an example question that I've come up with, and the format is pretty much similar to what we discussed for the paper 2 AS plan a study question. Okay. But in AS, the part B of the question was asking you to write a strength of your study, right? In the new format, at least. For those of you who are in A2 right now, when you were in AS last year, part B of the design study for you guys would require you guys to write a weakness of your study that you've designed. Okay, this is 2023. Those who took the AS syllabus in 2023, and then now you're doing 2024 A2. So you guys would be required to do something different in the A2 design a study question. So let's take a look at what it's asking. It says plan an experiment to test for gender differences in the effectiveness of ERP for the treatment of patients with OCD. Now, a question like this in A2, they always tell you two things that you must include in your answer. Okay. So, for example, over here, it says your plan must include details about sampling technique, directional or non-directional hypothesis. So these are two things you have to include in your answer, right? What else have they given you? They're saying plan an experiment. To test for what? To test for gender differences in the effectiveness of ERP for the treatment of patients with OCD. So you should be able to identify that they're asking you to check the effectiveness of ERP, which was the case study by Lempool on the 12-year-old boy named Jason, who had autism as well as OCD. So it was an example study. So you have to apply your knowledge of the ERP therapy that you learned from that topic in this situation that they've given you, where they want to see for gender differences, basically who will benefit more from ERP treatment in treatment of their OCD symptoms, males or females, right? And you have to do an experiment in order to do that. Right? So you must have an IV/DV. We'll discuss all the features that need to include in an experiment. Now, if you take a look at my paper 4 summary video that I posted earlier, you will see that I mentioned that in section B, you have a choice where you have obviously 4 options: clinical, health, consumer, and organizational psychology. And you've obviously studied 2. For section B, you will choose one of the 2 options that you studied. Okay? So for the plan a study part, you'll be required to either attempt the design study for clinical psychology or for health psychology, assuming that these are the 2 you've studied for. So you don't have to do 2, but you have to pick one. If you've done, let's say, clinical and consumer, then it's up to you whether you want to design your study for clinic, for consumer, or for organizational psychology. So whichever modules you've studied for in section B, you don't have to do both. You just have to pick one question. Okay, so I've gone for clinical because I think most students are doing clinical. So most of you will be able to relate to this. And even if you're not doing clinical psychology, you can still go over this video to get an understanding of how to design a plan a study, because the format is pretty much the same, right? Only thing different would be the content. So you have to design an experiment that's been given to you. You have to test for gender differences in the effectiveness of ERP for the treatment of patients with OCD. That's something that you have to include. That's the aim of the study. And you must include details of a sampling technique and a directional or non-directional hypothesis. Now, when it says your plan must include details about, it doesn't always have to be about the sampling technique or directional or non-directional hypothesis. It could be anything research method related. So in a different question, if they're asking you to design an interview-based study, they could ask you to include details of the type of interview, okay, the way you're going to be collecting data. They could ask you ethical guidelines, They could ask you if it's an observation, the type of observation. Again, if it's an experiment, then they could ask you the experimental design, right? So anything, ways to make the study reliable, ways to make the study valid, ways to make the study generalizable. So they could ask you anything related to research methods. Okay, so you should be prepared with your research method concepts, because you would have to apply your knowledge of research methods not only in this design study, but in the whole of paper 4, right? Okay, moving on. There are 2 more parts to this question in paper 4. Okay, so the whole question is for around, I think it's 24 marks. Let's take a look, 10, 14, 18, 20, yeah, 24 marks, with part A being 10 marks, which is the part where you have to design your study. Part B is split into part B1 and B2 for 4 marks each. I'll get to this later. And part C is also split into a few parts, 3 parts with 2 marks each. And we'll get to part C and B later after we've taken a look at the sample answer. Okay, so I've gone with a pretty simple question. I've gone with an experiment because an experiment requires quite a bit of detail. So we'll be covering quite a few points, such as the IV, DV, their operationalization, the experimental design, controls, etc. Keep in mind, the question which comes in your exam, like I said earlier, they will always ask you, they'll always give you the type of study they want you to conduct. Okay, like over here, they said, plan an experiment. If they want, they can be very specific and they can say, plan a field experiment. Okay. If they don't wish to give you an experiment, they can choose any other research method technique to give you. They could ask you to design an observational study. And if they don't specify, it's up to you to choose which one. But if they want, they can be very specific with that as well. For example, in the Feb series 2024, the February exam, which took place for paper 4, they specifically stated in the question for clinical psychology for section B, it was on covert sensitization, and they wanted you to plan a covert observation. So they were being very specific about the type of study they wanted you to conduct. Okay, so they can be vague, they can say observations or interview, or they can be very specific and they can say structured interview or unstructured interview, or participant observation, or structured observation. So you should know the features of each of these, because if they ask you to design, let's say, structured observation, and you don't know what to put in a structured observation, then you would end up losing marks in your answer. Okay. What are other research method techniques that they could ask you to design? A case study, okay, longitudinal studies, and perhaps even a correlation, even though correlations are more likely in AS, not very likely in A2, but you should still go over it. Okay, so these are the different research method techniques that they will definitely give you. It is possible, because in previous past papers where they won't mention the type of study, they'll just say plan a study, design a study. In that case, you will have the freedom to choose the type of study you want to conduct: experiment, observation, interview, so on, right? But obviously, you have to choose one that is appropriate or relevant to the question. And the other thing is, obviously, like I said, 2 research method related points that they will always ask you to include in your answer. Okay. Now let's take a look at what are the key points that we need to include when planning our answer. So I have a video on this for the AS paper, and it's pretty much the same. So I'll go over it again for those of you who haven't seen that video. There are 5 things we need to include in our answer: who, what, where, when, and how. Now, who refers to the participants of our study. Okay. And at times, some information would be given to you about the participants. Other times, it might be very vague. And in some cases, they may not mention anything. So you have the freedom to choose. Now, what we understand from our study is that the participants have to be male and female, because we're assessing for gender differences. Right? So that's one thing we cannot change. They have to be male and they have to be female, because that's the comparison that we're going to be doing. The other thing we cannot change is that these are patients with OCD, right? So this is the information we have about the participants. But how many there are, their age, that is something we can come up with ourselves. Okay? So the participants, you have to include the number of participants and you have to include their features. Along with the participants, you can also talk about any experimenters And when I say experimenters, I'm talking about the use of a stooge or a confederate, which is not very common in clinical psychology. So that's not something that you would need to put. Okay, in AS psychology, yes, you could put a stooge if it is appropriate to your question. But for something like this, it's not needed. The other thing that you can include in experimenters are observers. Okay, so if you're doing an observational study, or even if you're doing an experiment or a case study, and within the experiment or case study, you decide to do an observation, then you can include observers. You can talk about how many observers there are, the type of observation that they're conducting, are they overt, covert, participant, non-participant, and so on. Right? So that comes under the who aspect. The what will include the research method technique. Yes, so the research methodology. This will be given to you. As it says over here in the question, plan an experiment, right? So you can design, you have to design an experiment. And if you're designing an experiment, you must know what are the features of an experiment that you have to include in your answer. The features that you must include for an experiment specifically are, you must have an IV, you must have a DV, you must have an experimental design. All right? Every time they ask you to design an experiment, there has to be an IV, a DV, and an experimental design. If they ask you to design an interview-based study, or a questionnaire-based study, or an observational-based study, or a case study, in that case, there won't be an IV, DV, or experimental design because those are not features of an experiment. Okay? If they ask you to design an experiment, then you would include these things. However, within an experiment, you can include interviews or observations, as those are data collection techniques. Okay? So you would have to have an IV and a DV and an experimental design. Identify the IV, identify the DV in the question. The IV over here would be the gender of the participant, male or female, and the DV would be the reduction in their symptoms of OCD, okay, after going through ERP. So that's the dependent variable. And the experimental design would obviously, in this case, be independent measures because you're either a male or a female. It cannot be repeated measure design, right? So in some questions, where you have to design an experiment, you may have the freedom to choose if you want to go for a repeated measures or an independent measures design. It's up to you. But in some questions, you may not have that freedom. For example, over here, you can only do an independent measures design because you're either a male or a female. You can't take part in both conditions, right? So it's an independent measure design. If you want, you can also have a matched pairs design where you can match the participants in terms of age, okay, severity of symptoms as well if you want, the type of OCD that they may be suffering from. So you can include those features as well, okay? That will essentially be some controls of your study. So you have to include controls as well. The duration of the study, okay, that will be a control. Ways to make the procedure standardized. Everyone is going through the same procedure. That would be the controls. Under the what, you also have the sampling method. Okay, now this is something we have to include details about because it's mentioned in the question. So the sampling method could be opportunity or volunteer, whatever you feel is suitable to the study. But if it's saying give details about it, elaborate on how it's an opportunity or volunteer sample. For instance, if you're going for a volunteer sample, talk about how you're recruiting them, maybe through a social media ad. What was mentioned in the ad? Are you paying them? So, just give details of how you're acquiring the participants. You can include the aim and the hypothesis as well. In a question like this, you should include the hypothesis because it's telling you that your plan must include details of one-tailed or two-tailed hypothesis, directional or non-directional hypothesis. Now, it's up to you whether you want to write a one-tailed or a two-tailed hypothesis. You don't have to write both, okay? Data is important, okay? Quantitative, qualitative data, or both, and any ethical concerns that you might be considering in your answer. So all of this comes under the what aspect, okay? The where is the location of the study. And it says it's an experiment. Wouldn't make sense to do a lab experiment. I think this would be better suited for a field experiment. So we could do it at the clinic where the patients are coming to get treated, okay? So they're coming and getting CBT sessions. So it would be a field experiment. It would be the clinic of the researchers, right? So that's pretty straightforward. When is the time? Okay. How long is the study for? Is it for a number of days? If it's a case study or a longitudinal study, you can mention length, how many months, how many years, if need be. The duration of the study as well, like the sessions, how long are the sessions for, how long will they last, and so on. And how is simply an operationalization of the what. How are you operationalizing the IVDV? How are you placing the participants in the two conditions of the IV, basically the experimental design? How are you implementing controls and maintaining standardization? How are you acquiring the participants through your sampling method? Okay. How are you collecting data? How are you implementing ethical guidelines? So the how is essentially an operationalization of the what, and this is where you have to come up with your procedure, and you need to be a little creative. And of course, you can take ideas from the actual study that your design study is based on. Which brings me to a very important point. Let's just erase this. So the question in A2, be it clinical psychology, consumer, organization, or health, it will always be based on a topic from the syllabus. Like I said, this is ERP, the study by Lemkool, the OCD treatment and management, psychological treatment and management of OCD. So it's always going to be based on some topic from the syllabus. So you can take ideas from that, and you should, because part B is asking you to, especially B part 2, explain how you use two features of the psychological knowledge to plan your study. So your answer is going to be based on the study by Lemkool on ERP. You need to talk about two features of the actual study from your syllabus that you've also included in your answer. All right, so do take points from the original study, because you can talk about that in part B too. All right. Okay, so let's take a look at the sample answer that I've written. So it's good to start off with the aim. The aim of the study is to test for gender differences in the effectiveness of ERP therapy for treating patients with OCD. Right, pretty straightforward. Then I mentioned where the study is being conducted. It is being conducted at a clinic treating patients with disorders such as OCD, making it a field experiment. So I've explained why it's a field experiment, because it's being done in the natural setting of the clinic, with the participants being 5 males and 5 females. So now I'm getting into the sample, right? The who. And I'm mentioning how many participants there are. I'm mentioning their features as well. 5 males, 5 females, 20 to 30 years of age. So I'm keeping them within the same age range. All suffering from obsessive thoughts of contamination fear and compulsive behaviors of excessive hand washing. So one control I'm implementing is that all of them are the same type of OCD. Okay. As the participants are readily available at the clinic seeking treatment for their symptoms, the sampling technique is an opportunity sample. So I've given the sampling technique, I've said it's opportunity, and I've also explained how it's an opportunity sample, as these people are already coming to the clinic to avail treatment for their symptoms. Okay, so they're readily available. Then I talk about the IV and the DV of the study. The independent variable of the study would be the gender of the participants, with the male participants being compared to the female participants, with the reduction in their symptoms through ERP therapy being the DV. So gender is the IV, and reduction in their symptoms through ERP therapy is the DV, which is being measured through the Vibox scale, okay, which is something that was done in the actual study as well. This makes the experimental design independent measures, as discussed earlier. Now, I've chosen to write a directional hypothesis. A directional hypothesis of the results of the study would be male patients will have a greater reduction in symptoms following ERP therapy compared to female patients. Okay, so in the directional hypothesis, you pick one level of the IV and you favor that over the other when you make the comparison. For example, I'm saying males will have a greater improvement in their symptoms compared to females. If you wish, you can write females will have a greater improvement in their symptoms compared to males as well. Remember, it's a prediction, so you can write it either way. If you had opted for a two-tailed or a non-directional hypothesis, you could go on to say there will be a difference in the reduction of symptoms of OCD following ERP therapy between male and female patients, right? So you're not giving any specific direction to the results, you're just stating that there will be a difference between the two. Okay, let's move on. Where was I? Let's use the pointer. The study will begin, I'm getting into the procedure, okay? So the study will begin with all patients taking the Vibox questionnaire to assess for the severity of their symptoms, okay? So we're assuming that they've already taken the Vibox to get an idea of their symptoms before the treatment begins. Participants would have a minimum score of at least 16 in order to be diagnosed with OCD and to take part in the study. So remember, the score is from 0 to 40, and the clinical range for OCD is a minimum of 16. Each patient would then go through 10 50-minute sessions over 16 weeks of ERP therapy administered by an experienced therapist. So this is the when aspect. So there are 10 sessions, 50-minute each. This is a control. Everyone's going to the same number of sessions for the same duration, for the same overall time period of 16 weeks. This is actually something I've picked out from the actual study itself. Okay, the same duration. Okay. The therapist would begin by gathering information about each patient's existing symptoms through a series of open questions that would be asked during an unstructured interview. So the data collection technique that I'm using over here is an unstructured interview. Okay, so I'm getting into the process of ERP therapy. It begins by asking the patient about their symptoms, getting an understanding about their symptoms. And the way I'm going to be doing that is through an unstructured interview. Okay, the treatment would then commence. So the second part is the therapist initiated ERP treatment. It would commence with the therapist exposing patients to stimuli that cause them stress, for example, door handles, cell phones, or books that they believe were contaminated with germs. So I'm explaining the details of the treatment where they're being exposed to items that they feel are contaminated, because remember, they have contamination fear. The patients were taught coping statements during the exposure phase, such as nothing bad will happen. This would be done to habituate the patients with the stimuli and lower their distress and anxiety levels. So I'm giving quite a few details of what they're going through in their ERP therapy. Okay, most students just write an answer where they say they'll go through 10 sessions of ERP therapy and then they'll be assessing after the sessions are over if their symptoms have decreased or not, but not really giving any details of the therapy itself. So you have to give details of what's going on, okay, because that's essentially your entire procedure. So you be elaborate, don't be vague with it. They would then be asked to practice this outside therapy in real life situations. This is the third part of ERP, if you know your content really well, which is generalization and relapse training, where they encourage you to practice what we learned in therapy outside in real life situations, and would be asked to come for follow-up sessions at the end of every 2 weeks. At the end of the 16-week period, the male and female patients would be given the Y box again to test for any changes in their symptoms compared to baseline scores. So we're going to compare if there are any changes or not. This should provide quantitative data. So I have to mention the type of data that I've collected that could be analyzed through a bar chart to determine whether male patients had a greater reduction in their symptoms following ERP therapy compared to female patients. The qualitative data would be collected through the unstructured interview sessions conducted during the therapy. And then I'll just end by saying that the confidentiality of the patient will also be maintained, as their identities would not be revealed, because some people may be uncomfortable or embarrassed by their behavior and symptoms. So they wouldn't want their identities to be published, right? So we're going to be maintaining complete confidentiality, which is an ethical guideline that I'm incorporating in my answer as well. All right, so I basically checked all these points: the who, the what, the where, the when, and the how. I've talked about the IV, the DV, I've operationalized the DV, I've talked about the collection of the data. So I've included all the points that are needed in a 10-mark answer. All right. Now let's get to, I even mentioned, by the way, the two things they asked me to, the sampling technique and the directional non-directional hypothesis. Now let's talk about part B. For one piece of psychological knowledge on which your plan is based, describe the psychological knowledge. So this question for 4 marks is essentially asking you to just describe the actual topic from the syllabus that your study is based on, which is why when you're deciding whether you want to attempt the 10-mark question for, let's say, clinical or let's say health psychology, keep in mind 2 things. Keep in mind, you know, the features of the type of study they want you to conduct. So if they're saying design an unstructured interview, or let's say structured interview, you should know exactly what makes a structured interview a structured interview. If you don't know that and you attempt the question, you would lose marks. If they say design a structured observation and you end up turning it into a regular observation and you put self-report in it as well and turn it into an experiment in an IVDV, you would obviously be losing out on marks. So make sure you know exactly what the features and requirements are of each specific research method technique, especially the one that they're giving you in the question. Okay. The second thing you should ask yourself is, do I know what content this study is referring to from the syllabus? And do I know it well enough to answer question number B, part B? Okay, if it's on ERP, can I identify exactly what ERP was? Do I have enough information and knowledge about ERP for me to write about it in part B? Okay, so these are the two things you should assess before choosing whether you want to attempt the design question for clinical or for health, assuming these are the two options you studied for. All right. So for B part 1, you're just essentially describing the ERP study by Lempool. You can give reference to the Jason study, and you can talk about what ERP is, the 3 steps of ERP, the therapy, the part where you get information about the existing symptoms of the patient, the therapist initiated ERP, and then the generalization and relapse training aspect. And that they also use the Y-box to assess symptoms and so on. Then in B part 2, just mention 2 features of this study, this topic from the syllabus that you included in your answer. For example, the structure of how ERP works. For example, the number of sessions and the duration that Jason went through in the actual study, which I also made these participants go through. For example, the use of the Y-box to assess for reduction in symptoms, right? So any 2 features that the original study used, which your study also incorporated, just mention those. And then we have question number C. Now, question C is always going to be about these 2 things. Right? Your plan must include details about. So whatever 2 research method related points that they've asked you to include, part C will always be asking you about this. With C1 and C2 always being about the first research method item, and C3 being about the second one. C1 is always going to ask you what is 1 or 2 reasons. Okay, we have said 1 reason. Most cases, they might ask you 2 reasons. So make sure you know at least 2. Let's change this to 2. Explain 2 reasons for your choice of sampling technique. Okay, so why did you go for volunteer, or why did you go for opportunity? Maybe because they're readily available. Maybe because volunteer would have taken more time, so it would not have been very convenient. Maybe in volunteer you might have to pay them, right? If you decide to go for volunteer, why did you do that over opportunity? Maybe in volunteer you can get specifically who you require for your study, right? Whereas an opportunity you might not have control over that. If you're choosing volunteer, people might be more motivated to complete the entire study because they're volunteering. Whereas an opportunity, then there are chances of them withdrawing, halfway through the study. So whatever 2 reasons that you have for choosing that particular sampling technique, mention those briefly in C part 1. Explain 1 weakness of your choice of sampling technique. So what is the weakness of an opportunity sample? Again, you should know your research method content. What is the weakness of a volunteer sample? If that's what you opted for, you should know that as well, right? The weakness of an opportunity sample is that you really can't control the specific features of your participants. So in volunteer, you can still state that I want these many people of this age, with specifically this issue. In opportunity, you have to make do with whoever is available, right? And an opportunity, in a volunteer, however, you might have to pay them. It might be a little more time consuming. So that could be a weakness of an opportunity sample. Of a volunteer sample. So make sure you know your strengths and weaknesses of the sampling techniques, right? If this is an interview-based study, then this part could be maybe your plan must include details of the type of interview. And let's say you decided to go for a structured interview. Then they could ask you 1 reason for your choice or 2 reasons for your choice of a structured interview in C part 1. And in C part 2, 1 weakness or 1 strength of your choice of choice of interview. So you should know strength or weakness of a structured interview, for example, right? So go over research methods thoroughly because it's very important, not just for section B, but for the entire paper, section A and section B. And C part 3 is going to be on this. Explain 1 reason for your choice of directional or non-directional hypothesis. So you went for a directional hypothesis where you said that males will perhaps have a greater reduction than females in OCD symptoms. And you can give your reason for that because maybe you believe that, you're giving your result in direction because you believe that males will respond more or females may respond more, whatever your hypothesis is, you can give a reason for it. And you can say that the reason it's a directional hypothesis is because I'm giving the result a specific direction, okay, towards the male or towards the females, right? So that's essentially what you're required to do in your in section B. If you're confused about the entire format of section A and section B for paper 4, take a look at the video that I posted earlier. All right. For those of you who are appearing right now in the May exam for 2024, which is in a few days, date of which I'm posting this video. I'm specifically referring to clinical and health psychology right now. In paper 3, you had questions on anxiety disorders, schizophrenia, and mood disorders, which means that in paper 4, you can expect questions on impulse control disorders and obsessive compulsive disorders. And for health, in paper 3, you had questions on adherence, on patient-practitioner relationship, and on health promotion. So the remaining 2 chapters of stress and pain are what you can expect questions on in paper 4. Make sure you know your key studies really well, right? There will always be questions on the key studies of these chapters, which will come in paper 4. And like I said, know your content well, make sure you know the application of the studies in these chapters, and thoroughly revise research methods, because that's going to be your best friend in paper 4. Okay, so I hope this was helpful. If you guys have any further questions or confusion or queries, feel free to reach out to me. My details, as always, are going to be mentioned in the description below. So once again, hope this was helpful, and best of luck for your exams. Take care.